Good morning, good afternoon, good evening. Thank you so much for all of you for coming and joining us for the this podcast that we have recently started. This is about understanding the healthcare system and how technology, the great innovation and strides that we have seen in the last couple of years, has changed technology from its has changed the delivery of healthcare from its core and improved not only patient outcomes, but also the behavior and journey of a patient. And in that note, today we have with us Mr. Rajeev Srivastava. Uh, Rajiv ji, as I would like to lovingly call him, has been with some of the largest pharma entities in India and abroad. He has worked for several years with GSK, with the Reliance Corporation, in setting up their healthcare entities, hospitals, and in pan India supply chains of organizations like Cipla. He has worked with several different large scale entities in building networks and strategies towards revamping the entire healthcare system. And today he works with um, Tata Consultation Services, Tata Communication precisely, and heads healthcare innovation for them. So, on that note, I would love to welcome Rajiv Ji. Thank you so much for spending your valuable time and giving us a few notes of your wisdom.
Thank you very much, Dr. Sabine, for nice introductions, and really happy to discuss about the content, how the technology really embracing the hospital infrastructure. So really pleased to have here.
Thank you so much, Rajiv Ji. One of the one of the things that we always do not see happening is the adoption of technology on the back end. When we go to seek healthcare, say, for example, to a hospital or a healthcare center, we do not see all the different technical innovations that have gone into delivering faster, more seamless, more accurate healthcare to us. But you have been part of that journey, not just for a single entity, but for several large ones across the Indian subcontinent. So, would love to have your thoughts on that. How has technology changed healthcare ecosystem at large?
So if you see that, Sabine, first I would like to take the light on basically on the hospital infrastructure, how the technology they are really adopting, especially on the public and the private institutions, because they are the basically providing the healthcare facility to the people. So it all depends because India is a very diverse country, and the digital literacy is also varies from the city to city, region to region, state to state to adoption the technology, irrespective of the doctor is sitting somewhere in Nasik or doctor is sitting in a Bombay. So it all depends. So what my observation, because I am in interaction with day to day with the key opinion leaders of the corporate hospital versus mid-sized hospital. The corporate hospital exactly is that they are adopted the technology in a larger level, and they have set up, you can say the organization like Apollo, Fortis Max, they have already set up and they have already reached on certain mile to create a lot of good, automate the entire internal system and creating the good patient experience as well. But still the challenge is coming to the tier 2, tier 3 cities where the uh, talk, even the label of key opinion leader is a digital literacy is a critical problem. So just I will give you one example. Recently I was interacting with one of the prominent key opinion leader to tier 2 cities doctor, and he was telling that I'm using the HIMS system, hospital information management system, since 12 years, and it is on the on premises data per se. But when I asked the questions, how many times you see the analytics, how many times you see the patient data, and really it is really useful to you or not. So he told me, I have never seen the analytics as such. See, we are so this is this is this is this is the label of doctors are very
Mm.
efficient in their own job, but at the same time, once it comes to the technology, if they want to take the interest, they can understand easily, because they are, even though they are handling the most complicated human body,
Mm.
they can understand technology better than anybody else. But at the same time, their interest is very less on that particular subject
Mhm.
because they are busy. So that is how, the adoption of the technology is very poor in the tier 2, tier 3 city. Even though certain hospital is still on manual basis, they don't have any
Mhm.
records per se. So that is how, my point of view. Public institutions, they are quietly aggressive, and even though I'm in the consultation with some of the biggest corporations like railways, so they want to adopt this thing, but it will take a lot of time, because
Mhm.
the medical service also, basically, a lot of regulation is there, especially in the
Mm.
medicines, to adopt the technology. So government will take time, but I think the future is bright for digital health per se in India.
Mm.
So that's from
No,
my.
so you're correct. What you mentioned makes a lot of sense that even though, um, you know, there are organizations that have adopted and well some of the technology innovations that we see in terms of patient engagement, in terms of analytics, in terms of predictive behavior, but the organizations have accepted, not really the doctors. Even in an Apollo or a Manipal group, it's generally the CIOs who understand what's happening, but the actual delivery of care happens from the doctor, and they really are not uh, they are not technically upgraded enough at the current moment. The problem, I think, is also that these doctors do not really know the value of tech upgradation. If we are able to effectively communicate the value to them, as you mentioned quite rightly, people who can understand the human body, one of the most complex, association of mechanics out there, can definitely put in some effort to understand the clinical applications of technology. But it's just that there is a huge parity of people who create technology versus people who it's meant for, right? So I think there is a huge gap for sure, and I think organizations like yours, which is one of the premier organizations in technology communications, can definitely solve that problem, bridge that problem, when teaching and dispersing information to healthcare providers as to what's the need for such technical innovation. And I think that could be a start of a huge solution as well. So, I also wanted to understand, because you work with such large stakeholders from pharma to hospitals to governments, how do you see, what do you think has been the improvement or lack thereof in actual patient outcomes when it comes to technology? Because we have been spending resources, we have been spending energy and time into building some of these technical infrastructures. Do you think that's actually creating a difference in patient outcome? And if so, how?
So if you take that in healthcare, from my perspective, because I have exposure of the pharmaceutical, right, to understand
Mm.
from the drug clinical trials per se,
Mm.
pharmacovigilance point of view, and the entire drug journey per se to reaching to the
Mhm.
patient. That is one where exactly, technology can really help to
Mhm.
deliver the best medications in the markets. Comes to the, hospital segment, where, the if you see that lot of medical, error, because of the medical error, a lot of mortality is happening or happened, and that can be in very very reduced. That is one part of it. Even the chronic illness can be very well treated with the, technology, and can really help, and it cost saving exactly. Even see the, the patient portfolio from the point of the elderly age patients or chronic age patient, there is unnecessary trouble to the doctors. Even though, tier 1 cities, the people have now mentality to use the technology, where they can very well save their time, their cost, and everything, to manage the certain diseases, until unless it is very emergency per se. So that is one thing. And of course, EMR, electronic med, which is hot topic in every time. So it should be, basically, there is a two contradictions is also in this thing. There are in a tier two tier city, even though doctors, when I interacted with them also, they also don't want to keep the medical record. I don't know what is the reason behind it exactly. They don't want to keep that, but there is a challenge on that basis also. Doctor wants to use, but somewhere there they are not using that thing. So of course technology, especially if you see that sector which is coming on the wellness, primary care, there are a lot of startups are coming in this sector. That means there is a lot of huge scope, and there is a lot of patient benefit, lot of patient outcome. Lot of people can be solve this problem. So I think from primary care point of view, from the chronic disease point of view, for the elderly patient point of view, technology can really help to this community, and to more extent on the cost saving, to relieve, to relax. So even they can connect. So that is how my point of view.
No, I think you make a lot of sense. One of the key things that we have seen as a problem statement is, uh, indication. When we talk about indication, a lot of, there is a huge parity of information where a lot of indication markers are very subjective in nature. So we need to know whether a particular treatment, a particular drug, a particular surgery, is it really necessary or not? Risk assessments, right? And I think though the population that we are speaking about, the entire Southeast Asian population, has very little penetration of insurances, the whole concept is still very insurance forward, where we are talking about understanding of whether intervention is necessary or not, or should we go more, should we go less. I think these are the things that can optimize care delivery, cost of care, and as well as outcomes. And one of the major things that the data that we collect can give an outcome for is these kind of solutions, correct, where we can actually be able to, we are able to optimize the kind of delivery solutions that we provide. And as you said quite rightly, there are so many external solutions coming in now. There are startups, there are industries coming in the EMR space, which is now, as you mentioned, hot topic, because clinical intelligence is valuable. The way a doctor thinks, the way decision is taken is valuable, and very little of this clinical intelligence is stored anywhere in the world right now, because it's difficult to store. As the outcomes require years of data aggregation, and only then can you effectively monetize. And you know it takes capital investment to even store and maintain some of these records. So I think there are certain shortcomings, but we are slowly as an industry recognizing the potential of some of these outcomes.
Yes,
You were
of course.
saying,
At
yeah.
the same time, if you see that it is not the major population, moreover in the hospital setup also. For example, you take
Mm-hmm.
one example, the
Mm-hmm.
patient is in the ICU. The doctor is there in the hospital for 8, 9 hours. That is, if you
Mm-hmm.
the optimal care of the patient is more than
Mm-hmm.
90%. Once the
Yeah.
doctor is not available in the hospital, the optimal care is drastically down.
Mm-hmm.
Even though people are concerned, but doctor is doctor, no doubt. He should have the patient in the ICU in the critical situation. He should have the awareness about the patient, a lot of vitals every time.
Mm-hmm.
So that is how technology can only solve the problem. There are certain, I've seen there are certain doctors interview those who have adopted, and they are quietly satisfied that at least patient is under control. Yeah, I can see the
Mm-hmm.
patient at any moment of time. If I'm at home also, if I'm concerned for the patient, I can see the patient conditions,
Mm-hmm.
vitals. So that way, the optimal care can be provided in the major
Mm-hmm.
ICU settings.
No, you're right about that as well. I think we can never really have enough number of doctors, right? There is a huge gap. The rural urban gap is there, and apart from that, the number of doctors coming in commission versus going out, plus the actual years of experience you require to optimally deliver care in certain specialties like cardiology, nephrology, neurology, makes it technically impossible. So the other day I was speaking to some of these dialysis aggregators, and they mentioned that in India we only have around 4,000 odd nephrologists, which is nuts, right? Because with the excessive steroid use that we have proven time and time again has happened, nephrological problems are dime a dozen, and we have CKD, chronic kidney failure, which is very rampant, and still just 4,000 nephrologists, which is very, very
Very
problematic. So, how do you really? There is no other way but to optimize the use of the number of doctors. And I think one of the other things that we need to also do is decentralize care. Doctors should not be the only point of decision making for care delivery, right? Because how can a single person be given this much burden of this many patients? Because we have to decentralize the care. We have to make sure that there are other nodes which can take, smaller decisions, so that only some of the more critical patients and more critical decisions are taken by the key doctor. So I think that is one of the major applications of technology, as you quite rightly mentioned.
right. So technology can only solve this problem to provide,
Yeah.
educations to the paramedicals or, people who can
Mhm.
take care. Like if a person is in tier one cities where there is no nephrologist, the patient unnecessary traveling 500 kilometers to reach to nephrologist. And
Mhm.
it's a, it's a very challenging if you see that from the patient perspective.
Mhm.
Every patient is important, and for
Mhm.
whether it is belongs to the tier one, whether it belongs to tier one. So every patient is
Mhm.
important for this particular this disease. So that is how we can manage. So
And that's true. So, one of the things I really, because you have worked in these many different modalities, one of the things I wanted to understand is how does technology change the financial behavior as well as the financial status of healthcare facilities as such? You know, because it is a cost after all, and we have an adoption problem, not just in India, but across Southeast Asia. So, how do you think technology adds value versus the capital investments and costs that we have right now?
So of course, the technology adoption, and of course in the emerging technology, which it's a very costly affair. But at the same time, you see that one basic concept, they just entirely depend upon the aspiration of the hospital and the doctors. The revenue cycle management, if you see that hospital, it is the patient relationships with the hospital right from the beginning to end. That is one, and the internal resources, which this thing, uh, their efficiency of the work, their accountings and everything. Still, I have interacted with some of the clients because I'm giving you the more on the practical example as compared to the what is written so many articles. But the practical aspect is that there are certain hospital in India. What happens? They are not adapting. There are certain hospital in the tier one, tier two cities. They are feeling they are satisfied with what they are having. They don't need anything now. They are on this certain mature level. There is no need for to increase the patient. They don't think that the it's not the business which is important. It's a patient experience is also important. It's a patient experience, and of course the system should be automate in terms of this thing. So that is how the technology, what about the tech companies are there in the healthcare space, they should not tell the expensive technology, they should tell the experiences. They should tell the experiences which technology is never be very expensive until unless if you take the blockchain and other things there, that is very expensive. But at the same time, basic technology, if you understand cloud technology, basic software, if they can understand that very well, I think that can be solve a lot of problem in these cases. So revenue cycle, of course, there are certain, there's so many systems are there, even though there are certain in, I'm living in Mumbai, I'm telling in the Kharghar, one of my pediatricians, he don't have any patient record system. He sees 100 patient in a day in Bombay. And I told him, what is the problem? Why you're not using this one system? A lot of hassle is there, a lot of problem is there. So it's a mindset only. It's a mindset,
Yeah.
and he earns and he's spending a lot of time. He's having 5-6 resources to just entering the patient record, entering the patient filing, doing the filing in this thing. Entire department is for that. 6-7 people are working for that things. because he sees 100 patient in a day, and he's
But
not
all of that is physical.
all of that physical. All of that physically. If I don't carry the file along with me, my son records and everything, that he's telling where is the old file, then he go back to and see the library in Mumbai. I'm telling you, I'm
Yeah.
living in Mumbai. So there are certain areas of Mumbai is also, so it's a mindset. There is no expensive as such if you really want to understand and make people experience, because in the non-medico population, they
Mhm.
believe on the doctor's words. If doctors
Mhm.
uh, tell about the technology, use this technology, patient will use it. That is how the belief it is. Still, even rural
I
people.
wish that was always true, because if you ask my family, they are like, हम हर किसी की बात मानेंगे, आपकी नहीं मानेंगे.
Yes.
So I think, yeah, you're right about that. There is a strong affinity to the doctor's word, and we really can do a lot of good if we concentrate a bit more on patient experience and engagement also. But I think there is one more thing, we have not yet been able to understand health data from a small data set perspective or even an individual data perspective. If we are able to ethically monetize some of these data sets, that could drastically change the way we look at technology adoption. Because, then we are talking about cash in hand, both for patients as well as provider networks. And that can change the way we look at health systems drastically. Because now, in the last, 15 odd years post Web 2, the way we have seen big data evolve from business intelligence perspective all the way to clinical intelligence, we are able to understand that these things have value, and this value can actually be encashed and passed upon from the core entity where the value is generated all the way to the provider networks. So I think that is one thing that we really need to work on, both from a regulatory as well as technology perspective as well. What are your thoughts?
So, especially if you see that entire healthcare ecosystem, the if you in the lot of conference, if you see there is only one doctor who speaks about digital health, Dr. Devi Shetty. You see that the 12 lakh population of the doctors, how many? If you talk any banking infrastructure, you take any other
Mhm.
industry where a lot of people speaks about that code domain and talk about more technology, how many doctors are coming in this domain? And without the help of doctors per se, the
Mhm.
execution is very difficult.
Mhm.
And doctor community in India, see, they are, and you cannot teach them. That is also
Mhm.
one big challenge. No tech can teach doctors, because doctors having their one ego in front of them, that I'm a doctor, I can understand each and everything. So I think, I'm sorry
Yeah.
to say, you are also doctor, I'm sorry to say, but this is how the the philosophy which I understand, their overall behavior towards
Mhm.
learning, what they want to learn, they learn it. Somebody
Mhm.
cannot teach him until unless they
Mhm.
don't this thing. If they want to, they have desire, they can learn it. So without creating their desire, it is very difficult to go very this thing, a revenue
Yeah.
cycle. They can a lot of they, it's not very expensive today's time. If you see, they can very well manage that system, but only the concept has to be more creative way to tell them
Mhm.
how they can really use, more creative way, visualize to them the data analytics per se.
Yeah.
That is how we have to create a lot of interest in the doctors. Otherwise, you
True.
can't teach that community.
That is true. You need to create intent for learning. I
Yes.
think that could be done only by showing the value, not by telling about the value. You're correct. But moving aside from, the doctors and the problematic ecos that we have seen, especially in the surgical communities that we share, um, there are a lot of supporting systems around healthcare. So doctors are only the pinnacle of healthcare delivery, but there is the entire network of healthcare workers who are, who create the entire ecosystem for delivery, who are pivotal and instrumental and yet not very appreciated in this space. So I wanted to understand that, there are technical solutions now that empower them, that make sure that they are competitive, receptive, as well as comfortable using technology, adoption of technology, because a lot of the adoption of technology is also, let's say, not exactly done by doctors themselves directly, but is more outsourced to healthcare staffs in most areas. As you quite rightly mentioned, that pediatrician who sees 100 patients a day has a staff of 4 or 5 people who does just the data management side of it, though physical in this case. So, how do you see technology moving towards adoption and training of this trained workforce of healthcare workers in the coming future? Do you think there are actual technical innovation that is making a stand right now?
So technical innovation is a one side of it. At the same time, it should be user friendly, everything. And as far as the technical staff is concerned, the paramedical staff who really use the
Mm,
this thing, and they are the major partner to make digital health successful. Only thing is that what I have seen, because I have visited certain hospital in my assignment, and with the
mhm,
recommendation of the hospital, I have visited directly go to the their setup of the ICUs, how they are using the manual data, their diet schedule, their
mm,
recommendations, their this thing. When I started discussing some of the medical college, and I asked if I can put a system here entirely which can reduce your pain to put data again and again about the patient in one system where you can just entry and everything should be reflected, how you can how you feel it. So I think they are quite excited. Only thing they are telling that yes, we don't know, only that we need a very regular training, not only once, regular training about the users what we are doing. So there is a lot of, is this segment, there is a lot of award reward system is involved, where the human resources can play a major role to motivate
mhm,
these people. If you're putting the record, that is how the analytics coming, because of you are
mhm,
putting the right record, you are putting the right data in the
mhm,
system per se, and that is how the improvement area, these are the patient outcome, because these are
mhm,
the efforts. So it required a lot of involvement with these people. They are using the Facebook, they are using, everybody is using Facebook, they are using a
mhm,
lot of technology. It's not like that they are
mhm,
not using, they are using a lot of technology. Only thing that
mhm,
the influencing them very deeply, and of course making a lot of reward and system for them to use the system very effectively, putting the all data on the real time basis, all data on the real time submissions, so that they can take care of the system. Otherwise they will not take care. So
mhm,
otherwise people will say what is जो होता है वो चलने दो, अभी कुछ ऐसा
mhm,
नहीं कर सकते हैं. Only thing is that people are excited to work.
mhm.
You have to give just training in a such a way where people start taking interest.
No, I think what you mentioned makes a lot of sense, that not only do we have to start from the educational institutes for doctors, for healthcare workers, for nursing staff, for paramedics, and even frontline health workers, but we have to continue with that. It is not a one time thing, it's not a one time solution. We need to continue with new technology, growth of technology in these areas. And only then, and when we are able to effectively show the value added outcomes, only then I think it would be good for, and we can see large scale technical adoption. And on that note, I would really want you to throw some light on some of the government interventions in this space, because you have worked extensively with large government programs, as you mentioned, railways, defense, several others. So, India has a very vibrant frontline health worker network. Do you think adoption of technology, as you mentioned, is easy there? And if so, has it, technical adoption of some of these health delivery systems, like India's Poshan Abhiyan or several others, have they made a dent or difference in the system per se?
Come again, come again, just
So, India today has what you mentioned, as I said, was very pertinent, that we need to start with the training processes. We need to start with training paramedics, not just doctors, but paramedics, healthcare support staffs, nurses, etc. so that they are the ones who can also facilitate an adoption of technology for better outcomes. But along with that, India has a vibrant frontline health worker network of ASHAs, ANMs, Anganwadi workers, and the government and larger government systems have been trying quite aggressively in trying to have technical adoption in these networks. Do you think that has made a difference? Do you think that has been enough? And if so, how, what are the shortcomings? What are the what are the good and the bad of these systems that have been, that are now this architecture that's being created?
So even though, like, if you take from the government initiative point of view to upskilling these, workers per se, so the infrastructure, see, the initiative intention is right, but the execution level, of course, in certain area, certain, so it's not very, standard uniform. If you see that ABDM
Mm,
also is doing lot of efforts to integrate all the system, all the software which is available in India can talk to
mhm,
each other and share the patient
mhm,
information based on the patient.
mhm,
Only thing is that I think we are on the right path. Only some aggressive steps is involved. More people should be coming in the digital health. If you see that lot of, uh, lot of institutions is providing, like, MBA college, I'm telling you, MBA college providing like healthcare information management and all that. People should be enough motivated to come to join hands together, because the ecosystem should come that way, reach
mhm,
on that level to make it, digital health in India. So that
mhm,
ecosystem, people should be influenced enough, people should be motivated enough to make this happen. So more people
mhm,
are required, because technology can reach to that level, but
mhm,
human interactions in Indian perspective can't avoid. So one
mhm,
shot you need a training, one shot you need the
mhm.
interactions. Then
No,
only
I think, yeah.
that makes a lot of sense.
Yeah, I think what you're saying makes sense in that sense that there are bits and pieces of such solutions coming up, maybe at a state level, or part of the digitization of something is happening. But there is no real overarching connectivity where we are going into creating some of these digital infrastructure. I think ABDM is a step in the right direction, but there will require a lot of motivation in the private sector, in the healthcare delivery sector, to make it into a successful program with a successful outcome. So I think the government is working in some good ways, but we really need to push it across the edge as well. So, you mentioned blockchain, metaverse, a couple of things just a couple of minutes back as to, what are the kind of how that is one of the costlier adoption of technology. I wanted to know your personal thoughts because you have worked in so many different areas as to, do you really think this is necessary? If so, what are the real value additions that these kind of technology bring? Because eventually technology gets cheaper, more affordable, and adoption becomes easier. But what are the real use cases that you think in the healthcare space this will bring about?
So of course, the emerging technology having lot of, potential advantages, and of course there is a expensive expenses also involved in this case. See, especially the, if I see the augmented reality, and already adopted by the so many Western countries, where they can very well see the patient sitting here, then they can tell about your heart. This is the conditions you can see. So that feel, user experience is very important. So in these cases, of course, in India it will take time, but of course the what I'm excited about more about the AI, as well as the augmented reality. Blockchain, of course, it is a lot of misconception about the blockchains per se, until unless it is very much clear to the healthcare perspective, then adoption is maybe this thing faster, because banking, other sector is already using, but the healthcare is still in that setup. They are not, either there is awareness, lack of awareness is there, and that is one thing on. And of course it's the expensive technology, which is costly affair. Still we are on this stage to adopt the basic technology for the HIMS
Mhm,
and all, teleconsultation and all that. So
mhm,
this is on basics, but of course the AI and AR VR can really change this thing, entire domain. And this is and cloud. First of all, data is very important. Cloud technology is still, bigger hospital think that, even bigger hospital like, corporate, they are thinking that on premises, data storage is more safer and all that. But they exactly how the cloud computing technology really help them, they exactly don't know. So that is the one cloud. If all the data should be on cloud, I think it's a, win-win situation for the, overall economic of the country. So that is also important, per se. So these are the technology. Of course, emerging technologies,
Yeah.
exciting, but at the same time, gradually we can adopt.
Yeah. No, I also wanted to kind of, because you mentioned financial technologies and adoption in this space, I wanted to understand your thoughts on insurtech and insurance adoption in the Southeast Asian subcontinent. And how it's changing. As you have seen, you have been in the industry now for 20 odd years. How do you see that changing the way we approach healthcare?
See, if you see that, of course, in this segment, the blockchain can do a miracle, because the,
Mm-hmm.
the trust factor among the one is the insurance company, hospital, and the patient. There is a
Mm-hmm.
lack of trust. There is no trust in these parties, all three
Mm-hmm.
parties. In these cases, of course, the blockchain can do miracles to, do a lot of, the stop the frauds, stop the, data, and data security and everything. Of course, this technology can do a miracle in this overall ecosystem and
Mm-hmm.
create a lot of trust among the stakeholders, which is always lacking since
Mm-hmm.
long. The doctor don't believe on the, patient, and patient don't believe on the doctor, and insurance don't believe on the doctor as well as the patient. ठीक है. So that is how, critical, triangle is there.
Mm-hmm.
So of course this technology can really solve the problem when there is a too much transparency is there. So this can really help the system, especially in this triangle person.
No, I completely agree, and I understand what you're trying to say. Creating that trust value is going to be very, very important. And bringing in a third party that is involved, which is aligned financially towards better health outcomes, is going to be critical in trying to revamp the way, out of pocket expenditures and cost of care has been structured now for decades in this part of the world. So, thank you so much. Your insights have been interesting, anecdotal, and very, very helpful. Um, I know we are short of time for today, but it would be great to speak more with you about some of these things and take the conversation ahead. Thank you so much for your
Thank
valuable
you.
time.
Thank you.
Thank
And
you, Rajesh.
all the best.
Thank you.